In this video, we're going to demonstrate functional dry cupping to the TFL and glute med area, along with the Quadratus Lumborum and the oblique area of the lower back. Okay, so we're doing this in a standing position so that the client can apply a functional stretch. This will help to decompress the area and to produce a functional release within the muscle tissue. Okay, so the key areas that we need to get the cups onto is the TFL region, okay, or Tensor Fasciae Latae region of the anterior and the lateral hip. And then also we want to come into the QL area of the back. We can also come into the hip flexor area at the top of the hip as well. So to do that, we need to adjust the client's clothing. Okay, so we're just going to lift up the shorts here, and then we're going to lower the shorts down here as well. Okay, we also need to make sure that we're applying medium to the area. The key reason for that is the client is going to produce a stretch, so that if we haven't applied medium to the area, it's going to produce too much friction between the cup and the client's skin, so therefore it'd be a bit uncomfortable. Also, the medium allows us to apply more suction to the area as well, as it creates a seal with the cups. So the medium that I'm using today is lotion from Physique, but it doesn't really matter which type of medium you use. You could use lotion, you could use oil, you can use wax. Okay, so I'm going to again pop the medium on, so anterior of the hip, okay, lateral side there as well, and then we're applying the medium around this area too. Bring a bit of medium into the front of the hip, that hip flexor area, and also around that lumbar area too of the back. Okay, so the medium doesn't need to be fully rubbed in, it just needs to be on the skin to reduce that friction. The cups that I'm using today are the hand sole cups, okay, and this is the 17-piece kit. So first of all, I'm going to go directly above the greater trochanter. Okay, then we're going to come anterior, okay, so the front portion of that TFL region. Then we're going to come above, anterior, just making sure that it is making contact with the skin and not the client's clothing. And then if you just turn to the side for me slightly, Lydia. Oh, I will replace that one in a moment. Okay, so we've got some cups there at the back too. Okay, now before the client starts moving, we're going to go back round all of these cups and make sure that they're nice and secure. Can you feel a little bit of a stretch with these cups? Okay, excellent. So they should be feeling a little bit of a stretch, so that when they go into the movement, we're then producing a deeper stretch. It's like a double stretch. So we've stretched the tissue here with the vacuum cups, and then when they go into the stretch, they are increasing that. So that's going to trigger a deeper release in the muscle fibers and trigger that relaxation response. So the stretch that Lydia is going to do is going to be the standing TFL stretch. So she's going to cross this leg over her other one. Okay, and then from here, she's going to kick the hips to the side slightly. She might now start to feel more of a stretch in the TFL area. Okay, and then she's going to lift this arm up above the head. Now you need to be mindful that the client isn't rotating, because sometimes there's cheat moves which naturally occur where they'll rotate slightly forward, and then some people will rotate slightly backwards. But because we want to come into this TFL region, we literally want them to go over to one side. Okay, so we can hold this stretch statically for about 15 to 20 seconds, or we could do a dynamic stretch sequence, so where the client comes back, okay, and then they cross the legs again and then come into the stretch, okay, kicking that hip to the side very slightly to increase that stretch if you need to, and then going back into that movement 3 to 6 times. So sometimes it's quite nice to combine those, so client can cross the leg over Okay, keep the legs crossed this time. We're going to come into that lateral flexion. That's it. And then kick out. Perfect. Then come back to that neutral position. That's it. Okay, and then again back over. So we're increasing and decreasing the stretch here. And then last time, take it over. And then this time we could hold that stretch statically. And again, ideally, we would repeat this stretch on both sides of the body as well. Okay, so that was our vacuum functional dry cupping to the TFL and QL area.